We will talk about the anatomy of the human respiratory system. First, we will talk about the component of the respiratory system. First component is the nose, pharynx, larynx, trachea, and bronchi, also the lung. Uh, the respiratory system can be divided according to the position into two groups: the upper airway or the upper respiratory system and the lower respiratory system. The upper respiratory system include the nose, pharynx, larynx, and the lower respiratory system starting from the trachea, bronchi, and the lungs. We can see these components in this picture. Here is the nose, and all of this is the pharynx in three colors. Here is the nasopharynx. It comes from the nose. And here we have the oropharynx. It comes from oral cavity, so it is oropharynx. And laryngopharynx. Laryngopharynx, it comes from the larynx, and it is the connection between the larynx and the pharynx. Here we have the lung, and surrounded by a membrane called pleura or pleura. Pleura is pleura is one pleura, and pleura is both lungs. The pleura is a membrane surround the lung. Here we can see the difference between the right lung and the left lung. The right lung consists of three lobes: the upper lobe and middle lobe and the lower lobe, and separated by fissures, two fissures. And the left lung consists of only two lobes. So we have question here: how many lobes in the right and how many lobes in the left? You can answer this question. Another important structure here called the hilum. Hilum consists of many structures. The first structure is the bronchus. Here is the bronchus, right bronchus and left bronchus. And we have the pulmonary artery and the pulmonary vein. We have the left pulmonary artery and left pulmonary veins. So we have a question here: what are the components of the hilum? The answer is bronchus, pulmonary artery, and pulmonary vein. Another question here: what are the blood vessels of the respiratory system? You should remember the pulmonary artery and pulmonary vein. Another question here: what are the membrane surrounding the lung? It is called the pleura. Now we will talk about the function of the respiratory system. It brings oxygen into our bodies, which we need for our cells to live and function properly, and it helps us to get rid of the carbon dioxide, which is a waste product of the cellular function. Now we will talk about how they work. We have the alveoli, which is the functional unit of the respiratory system. Here is the alveoli. It is the distal part of the bronchus, and we have the pulmonary artery and pulmonary vein. They are close together, and it has terminal branches which is close together, and gas exchange can be happens here. As we talked previously, the pleura is the membrane which cover the lung, both lungs, and diaphragm and intercostal muscle are also one of the component of the respiratory system, and it is the muscle which work in respiratory system. Breathing for premature baby. When a baby is born, it must cover from getting all of its oxygen through the placenta to absorbing oxygen through its lung. This is a complicated process, involving many changes in both air and blood pressure in the baby's lung. For a baby born premature, the change is even harder. This is because the baby's lung may not yet be mature enough to cope with transition. The major problem with the premature baby's lung is a lack of something called surfactant. This is substance produced by cell in the lung which helps keep the ear sac or alveoli open. Without surfactant, the pressure in the lung change and the small alveoli collapse. So, we have an important substance called surfactant. This substance prevent alveoli, which is the functional unit of the lung, to collapse. So, surfactant prevent alveoli to collapse. Respiratory system and aging. The normal process of aging is associated with a number of changes in both the structure and function of the respiratory system. These include enlargement of the alveoli. When you become older, what will happen to your respiratory system? Enlargement of the alveoli, and the air space gets bigger and lose their elasticity, meaning that there is less area for gas to be exchanged across. This change is sometimes refers to the senile emphysema. So, when you become older, you should know these difference. Enlargement of alveoli and airspace become bigger and lose their elasticity. The compliance of the chest wall decrease, so it takes more effort to breathe in and out. The third difference when you become older is the strength of the respiratory muscle decrease. This change is closely connected to the general health of your person. All of this change means that an older person might have more difficulty coping with increased stress on the respiratory system, such as with an infection like pneumonia, than a younger person would. So, in this lecture, we know the component of the respiratory system, and we know the component of the upper respiratory system and the lower respiratory system. We see the structure of the upper respiratory system and the structure of the lower respiratory system. We know the difference between nasopharynx, oropharynx, and laryngopharynx, and we know the component of the hilum and what are the blood vessels of the respiratory system, and how many lobes in the right lung and how many lobes in the left lung, and what is the membrane surrounding of the lung. And we know the functional unit of the lung, which is the alveoli. Also, we know how gas exchange between capillary and pulmonary artery and pulmonary veins. Finally, we see the difference between old age and young age, and there is an important substance which called surfactant, which prevent alveoli to collapse. And we see the difference when you become an old age. There is enlargement of the alveoli, and the air space gets bigger and lose their elasticity. Also, compliance will decrease. The strength of respiratory muscle will decrease, so the respiration will become difficult.